hair's messy again. It was
Good
good this
morning, everyone. We're here. This is Lourie. I'm here with my dear colleague and friend, Margie Bissinger, who is a physical therapist, an author, and a happiness expert, and an expert in bone health. Margie just had an amazing, very successful summit, which many of you were participating in, on osteoporosis and bone health. And she's here to share her wisdom with us. And when you have breast cancer or have had breast cancer, when breast cancer is part of your life, osteoporosis comes along with it. Isn't that a lovely addition? As if there isn't enough already, because when you're put on tamoxifen and aromatase inhibitors, they create an unhealthy relationship with your bone matrix, as does chemotherapy and radiation. So we all have to protect our bones. Welcome, Margie, and thank you so much for being here.
Oh, thank you, Carol, so much. And I'm so glad to be here with everybody because there's a lot that can be done. So that's good news.
This is the message. There is a lot that you can do to care for your bone health. And Margie, why don't you just tell us a little bit about how you arrived to this expertise and about your wonderful summit and share some of your knowledge with us.
Okay, sure. So years ago, so my background is I'm a physical therapist and I was working in orthopedic physical therapy. And then I moved. I was living in Chicago, moved to New Jersey. It was in private practice. And I was working with people with head and neck injuries and back problems. And a group of doctors approached me. And this is way back. This is before even Fosmex was available. You know, the medication.
This was like in the 80s.
This is like over 25 years ago. And they approached me if I'd see their patients with osteoporosis. And I said, sure, no problem. And not that anyone was totally trained in that, but I had enough knowledge to know what to do. And I was absolutely shocked because well-meaning individuals, you know, the doctor said exercise. And so they didn't know where to turn. This was even really before the internet. So they were going to magazines and trainers and embarking on exercises that actually increased the risk of fractures. And that I couldn't believe it. So I said, you know what, I really need to work. I need to delve into this. And I did. And I took lots of courses. I wrote an exercise guide that doctors were giving to their patients. I got involved on the state level in New Jersey, overseeing all their programs as well as the national level.
Way to go.
Yeah. And then the good news is what I saw. So that was part one. And then as a physical therapist, then my son got type 1 diabetes. And I saw how incredible the power of food was in managing his chronic issues. And I thought, you know what, that's really missing with osteoporosis. No one's really telling people. They're saying get calcium, but no one's giving good guidelines.
It's more than dairy, right? It's more than dairy that we need to be concerned about.
Yeah, so anyway, I went back to school. The person that helped him so much was a health coach, studied nutrition, became a health coach. And I've always taught happiness. That's something that sort of is something I saw very early on in my career, that I'd been through a bad situation and people are like, you're so happy. And I realized it was an inside job. And I started teaching patients, chronic pain patients, what got me through that. And I saw miracles happening. So that's always been
wonderful that we have to teach happiness, that you can teach happiness.
Yeah, you can.
About this. And happiness is different than gratitude.
Yes. Gratitude's a part of happiness. Happiness, though, and people think, you know, happiness is, oh, yeah, I have cancer, great. That's not happiness. Happiness is not walking around with a fake grin on your face and living in like a Pollyanna state of denial. That's not it at all. It's a deep sense of peace and well-being that you have regardless of your circumstances. And I also added one more phrase to that, living your life in color, because so often, so many of us just are getting by in black and white. And we're not meant to live life that way. We're meant to thrive. So it's sort of a combination of those. But yes, the good news is that everybody has the ability to increase their happiness level.
I think that's beautiful. We all need that. So let's focus on the osteoporosis and the bone health first, because that is a very big driving factor for my community. And you have expertise that we all need to know about.
Okay, so I think there's a lot of things. I think the number one thing is no matter where you are, even if your bones are good, and this goes to people with and without cancer, everyone has to pay attention to their bones, because what you do at any stage in your life is going to affect later on. It's sort of like a bank, you know, where we have bone at the age of between 18 for women and 20 for men. We have the most bone we're going to have, our actual peak bones, our actual peak bone is, by 30, you have the most bone you're going to have. But you have like 80 to 90% of your adult bone at that age. So every age matters. But then throughout life, you want to keep making deposits. And as we get older, and especially with menopause, after 30, you really don't gain more bone. And then after menopause, when we lose our estrogen and other things happen as well, and with chemotherapy and different issues, we can be losing bone. So we want at every age to really build as much as we can and make this a priority. And I think there's numerous things. I think it's a combination of nutrition, exercise, and then there are a couple other things that can be done, as well as stress. Stress, like everything else, negatively affects your bones. It actually affects the bone building cells. So I know you teach so much of this, Carol. Any of the stress reducing techniques that you teach and all those great tools help your bones as well, because it actually increases the osteoclast, stress, the cells that break down your bones. So it's a combination of all those, and we can go into each one, because I think the exercise piece is so important. And this is what I see people get wrong. Not that they get wrong, they just don't know, because the doctor will say, okay, exercise. So people think, okay, I'll do a 10-mile walk. I'll do that every single day.
I just asked about walking, and how walking is walking is great for your muscle and your tendon strength, but what bones need, because I was doing some research before we came on, because I wanted to refresh my brain, bone health needs resistance, correct?
Yes. So what they found, and that's the good news. The good news is bone responds to the forces placed upon it. And so there's two types of forces that they found. One of the best is resistance. So when you're like contracting, let's say, you can see, when I'm contracting my muscle against a weight, that what happens is that force is pulling, it's tugging on the bone, saying, hey, we need more bone here. So it's resistance training. And the thing about resistance training, it's acting, people think, oh, I'll lift 2 pounds and I'll do that for 10 years. Not enough. It needs to be more than you're accustomed to. And what they found, it's not the repetitions.
A little bit. It needs to hurt.
It doesn't really have to hurt. It has to be, what they found is that, they call it like 80% of one repetition max. But what it is around, if you can do something, I like to use around 10 repetitions, 8 to 10 repetitions. That's all you want to do. But by the 10th repetition, it's hard to do. Yeah. So it's not a matter of repetitions. It really is the resistance and the forces that are coming. And so, the amount of weight and you want it to feel somewhat hard, ideally, if you can. A lot of people like to start at maybe 15 reps if they haven't done any exercise first. Something that they can do 15 reps and then go down to, work on like sets of 10. But by 10 that you're tired. So again, it's challenging. My biggest, if I could tell you one thing, I would say see a physical therapist. And it's usually covered by insurance. That's the good thing. And a lot of doctors don't write that prescription, and they just say, oh,
ask for it. It's very easy to ask.
Ask and say, you know what, I don't feel comfortable. And even if you're doing preventative, or even if, you find out that you're going to be on certain medication, just to make sure, someone to make sure your posture's good, make sure you're doing everything so you're not hurting yourself. Because the studies that were done that really showed increase in bone density were done with high resistance, also impact. So weight bearing, like, yes, walking is good, but things like jumping and things, where there's more impact, but you have to be careful, because, and that's why I think it's good to see a physical therapist, because they can help you. Okay, you can always, for everybody, they can maybe, go up on their toes and go down on their heels gently. But, for some people, depending the quality of your bone, jumping might have too much impact. So but that's why it's so good if you can see someone who has experience with osteoporosis. And there are people that do. And I can give you links too, that how people can find people where they live. I'll give you some links, Carol.
Okay, I'll send out another email after our interview to my community with all this information from Margie. So no worries, ladies.
Yeah, so resistance training, at least twice a week, not on consecutive days, 2 to 3 times a week, makes such a big difference. And then you gradually increase. Again, nothing should hurt. You want to make sure you're always in good posture. Very, very important. And that you're doing things that, to strengthen the bones. The big areas are the hips, the spine, and the wrist. they're comprised of trabecular bone. So those are the most easily fractured. And that's our goal. Our goal is fracturing. Our goal is preventing fractures and keeping our bones strong. So the resistance training is amazing. Again, weight bearing still is good. So it's still good to be walking and doing all those things. And then if you can have more impact, if you're able, if you're preventing this, you're sure doing jumping and all that is getting forces through the bones against gravity. So those are possibilities. The other thing, and I'll give you that. Can I give you a couple of things, Carol, to share with you?
Please. I'm putting notes in the chat. Yes, go ahead.
Okay, great. Because there's something really simple. It's like a very gentle stomping. It's a qigong that you can just do through the day just to get forces. So I have a video of me doing that. So I'll give that to you as well, so you can share that.
Great, wonderful.
So again, exercise is absolutely key. And, here's what you need to avoid. The thing that they found, they did a study. Well, I'll tell you what you need to avoid. You need to avoid rounding and forward bending if you have osteoporosis. Oh, do I have my spine here? Yes, I do. Okay, so for those, and the reason that is, if you see this spine here, you can see that. Can you see that, Carol?
Yeah.
So the one at the bottom here is nice square shape. And that's ideally what we want. This is the front of the spine. This is the back. And that's ideally what our spine should look like. But you see here in the front of the spine, it's wedged in the one above here. That's what happens when you have osteoporosis and when fractures start happening. The spine gets compressed in the front. So now think of taking the spine and rounding it out more. If you're rounding out more force is going to be right in the front of the vertebrae of the spine where it's already weakened. And they did a study at Mayo Clinic a while ago looking at people doing different types of exercise programs. So they looked at people who were doing like only rounding exercises, touching your toes and sit-ups and all that. And they found, ready for this? It's awful. And these were people who had osteoporosis. So they looked at them over a 6-year period of time. 89% fracture rate.
That's alarming.
Isn't that crazy? Versus going backwards, like extension, when you're doing things to strengthen your back muscles, they only had a 16%. So that was way better than the control group. So you really want to avoid the rounding and forward bending. Now, not to say you can't do everything. People always ask, well, can I do Pilates or can I do yoga?
Jackson is asking about yoga. Can you do yoga?
And I'll give you two. I'm going to give you a bunch of stuff. I'll give you 2 links. Yes, you can do all of those, but you take the precautions. And in the links are going to be physical therapist who was on my summit, Sherry Betts, wrote these 2 outstanding handouts she did for the National Osteoporosis Foundation, showing you exactly what poses are safe and exactly which ones aren't. But basically, you do things in a neutral spine, maintaining, everybody has that inward curve in their low back. So you're in a neutral spine and you're bending from the hips. It's called hip hinging. So instead of rounding your back out, you're just doing neutral postures, extension postures, and you're able to adapt everything. I love yoga. Yoga is such a wonderful mind-body exercise. And same thing with Pilates. But you want to avoid the extremes. So you want to avoid like the real extreme rotation and extreme side bend, because that just puts a little torque. So just back off a little and don't let the teachers come and do overpressure. So those are the basic guidelines, but they're really spelled out beautifully in these handouts that I'll share the link with you so you can share
I'll
with everyone.
post the links also in the Facebook page group here. So everybody, not only in my community, but everybody also in this community on Facebook will get them. So no worries, ladies. Okay.
Okay. So that's the exercise. The other thing that's really important about the exercise is because most people, what we want to do, we want to have strong bones, but we want to also prevent fractures. So balance exercise. Everybody, not everybody can do strength training. And that's also where the physical therapist can come in, because, if you have an injury with your knee or you have another, people have other things going on that precludes them from maybe doing some of the exercises, but you can custom make a program. And they even now, Carol, have something that's called blood flow restriction exercises. I'm sure most people, I have a podcast episode on that, but where they actually restrict the blood flow and it sort of fakes out the system. And I'm not going to go into it now, but it's a way, if you think, oh, I can't use heavy weights, there are ways around it actually that you can still get benefits. So it's just something, as I said, I have a podcast episode on it, but it's something that you can work with physical therapists on that. But anyway, but what everybody can do, every single person can do balance exercises. And whether you're standing on one foot,
You're
Tai
holding
Chi,
onto a chair. You hold onto a chair so you
start
don't
with
like
holding
fall.
onto it. You always start with holding onto a chair. And then as you can do that, you can have your hand available. So, and then gradually lifting up if you can, if not even standing tandem with one foot in front of the other. Doing Tai Chi has been shown, they've done research on this, one of the best ways to improve your balance. And, just shifting your weight back and forth and doing things like that gives your body that sense of where you are in space, so that if you lose your balance, you sort of have that motion. It's really, really wonderful. So there's lots of ways that you can practice balance, every day even. It's just easy, and it makes, because as we get older, everybody, if we don't use it, we lose it. So
No,
it's
it's very
yeah.
important to get off that seat or that couch and do active movement. Thank you, Margie. Really, you're right.
Yeah, so exercise is such a big deal, and just really make it a priority. And the good news is that most people don't go high enough. I think that's part of the problem. Most people think, okay, I'm doing 2 pounds, or they're just doing maybe their biceps and triceps, but you need to strengthen the back. So whether
Yeah,
it's pulling things, whether it's all fours, one arm, one leg,
like this.
things
Yeah.
things that are giving resistance. But I really, really suggest, even at one time, seeing a physical therapist, getting a custom design program for you, so that you're getting the maximum benefit from it, because this is where you can make such a big difference in terms of your bone density at all ages. It's never, ever too late. And the fun thing about that, though, because I work with people, seniors all through New Jersey, and there are people 85, and we also have classes throughout New Jersey on bone health. And I oversee this. And so I'll go see a class, and there are people 85 years old helping me move chairs.
Love it.
When you start getting into exercise, there's just nothing more empowering than being stronger. You feel great. And
Yeah.
so many people embarked upon this type of exercise program because they had to, because they found that they had osteoporosis. But the silver lining is they feel so good, and they can do so much more in life because they are stronger. So balance, posture is really important, and the strength training is huge.
Okay, that's one part. Now, what about nutrition? Let's talk about supplements. And I also want to talk about the relationship between estrogen suppression and bone health, because I don't think a lot of women know, okay, they're given tamoxifen or aromatase inhibitors, and they're told by the doctors, now you have to take this drug and you have to come in for an infusion every 6 months for your bone health. But what happens when estrogen is suppressed? And women who don't have breast cancer, in your 60s and 70s and 80s, get osteoporosis also. So, but breast cancer puts you through speedy menopause, and then you get osteoporosis sooner. So what's the relationship between estrogen and osteoporosis or bone health?
Estrogen has a protective effect on the bone. Right. So when we lose that estrogen, that really expedites bone loss. So when that happens earlier, then more years without estrogen. So it's a huge issue. The interesting thing, tamoxifen actually, that actually can help bone. They've actually found tamoxifen, but the other ones, the aromatase inhibitors, absolutely have significant negative effects on bone, and really, are associated with bone loss. So you need to do things to counteract that. You really need to take this very, very serious, because I may not say that. I think they do, though. Carol, do they? Do they tell people? I think they tell people that this can affect your bones.
Oh, I mean, if they don't, then it's a medical miss moment. But most women in my community are told, you're going to be on an aromatase inhibitor, you will get osteoporosis, and here's a drug that you need to come in for every 6 months infusion. And I'm saying, we need to do natural and integrative tools, and maybe you don't need that drug because the drug has some pretty serious side effects and makes a lot of women can make a lot of women sick. So, but
Yeah.
even if you're on that drug, you also need to do these other things. And the other thing that I've been very concerned about is women come to me, one woman in the group, well, my oncologist told me to ask the pharmacist about calcium. And she went to this is a very important topic. It's not like a simple topic. There are, I did hours of research to come up with my recommendations for some of the products that you need. It's not just calcium. You need a very specific combination of a certain form of calcium with, D, K, K2, and K7. So, the pharmacist said, oh, go to aisle 3 and take this product. And it was like, are you kidding me? This is not even a calcium that you want a 20-year-old to take. So ladies, it's more than calcium. You need a very specific form, and it needs to be in combination of with other products. But yeah, so Margie, sorry, I'm going ahead of myself.
No, you're absolutely right. And it's very upsetting because what I see actually is that people, the doctor will say, and I don't fault them, that's what they learn. It's shocking to me because I go to national meetings with physicians, and these are people who are dealing with this at a very high level, and they just don't get this piece. They understand every drug and everything to do, but that's what they learn. They don't really know the difference in calcium. So a lot of times the doctor will say, okay, well, the standards in the United States, now this is different than England. The standards in the United States are 1,200, anyone over 50, 1,200 milligrams of calcium. So they'll tell you take 1,200 milligrams of calcium. The problem is more is not better. And it's a combination of your food plus the supplement. So I see people and they're getting way too much calcium. They're not getting, we'll talk about that in a minute, these other nutrients that are absolutely essential to help absorb the calcium. And there's problems with that. There's been studies, nothing 100% conclusive, but showing too much calcium. There's correlations with cardiac issues because the calcium is going places we don't want it.
In the arteries, kidney stones.
Exactly. So more,
and it's the wrong form of calcium. So you're not even doing the right thing for your bone health. It's not calcium carbonate, right?
It's true. Yeah, a lot of people will think, oh, I'm taking the Tums, or I'm taking the calcium carbonate. And that's a whole nother story, but needs acid in your stomach, and it reduces stomach acid, and reducing stomach acid is a problem because we need to break down our food, to break down the protein and the nutrients we need ample stomach acid. So and they've shown people who are on all of those, the Nexiums and the Prilosec and the proton pump inhibitors, that's a real risk factor because they don't have enough stomach acid. So here you're taking a calcium, reducing the stomach acid, just like you said, Carol. No. I know you like the same calcium. What's your favorite? Right. I think we like the same one. Your favorite is the microcrystal, right?
MCHD, microcrystalline hydroxycalapatite. Ladies, Tums is spent a lot of money on advertising, helping you think that you should take Tums for your calcium. And it is exactly the opposite. Please do not buy into that advertising $1 million budget. It's not Tums.
Yeah, and so the thing is this, even though the National Osteoporosis, now they've changed their name actually to the National, I think, Bone Health. They changed, it's really good. They're coming along, which I'm so, they really are recognizing that everybody needs this, not just people with osteoporosis. But anyway, so the key is everybody says, get as much as you can from your food and then supplement only what you're not getting. So it's not as though you want more. You just want to, as much as you can from diet and then supplement as needed. So yes. So here's the other things that you alluded to. So yes, the calcium, but again, that's what the doctor says. Calcium and vitamin D, and the doctors are good about that. They check your vitamin D level, and that's important.
Some of them do. Not all of them do.
Well, maybe because I work with osteoporosis, so the doctors the people who are sent to me all have osteoporosis. So that's an interesting point that you're saying that someone who's maybe having cancer treatment isn't getting their D level checked.
Vitamin D should be a standard. It is a standard blood test. It's not a touchy-feely test. And in my opinion, for every person right now with not only bone health, but also viral and immunity health, everyone needs to have their vitamin D levels checked, because we've known that as Americans, we're all vitamin D and zinc deficient. So we should all be getting these when we go in for our annual blood work. Doctor, I'd like my vitamin D checked, please, and my serum zinc level checked. Go ahead. Sorry, I'm on a
Yes,
tangent.
no, I couldn't agree more, because this isn't a guessing game. It's not as though we have the ability easily to see where our level's at and how much we need to supplement with. Because a lot of times people will say, yes, granted, most people need at least 2,000 to 5,000, but not everybody, Yeah, I know I
No,
take 5,000 myself.
listen, I think everybody needs 5,000, unless you're living in a very sunny place and you are outside doing power walks for 20 minutes or 40 minutes, or you're gardening, but then you have to, protect your skin so you don't get skin cancer. So in my book, everybody needs 5,000 IUs a day, and it should be taken in the morning with a fat meal, because it's a fat soluble supplement. But some people come into my practice and they've been given 50,000 by their doctor. Now, here's my thought about that. There is no such thing as 50,000 IU of vitamin D in nature. So you don't really want to take, it's like being a bull in a china shop. At the most you could take 10,000 for 2 months. If you're I had somebody come in with a vitamin D level of 14. That is alarming. That's dangerous. So the levels that I like are between 50 and 75, right?
Yeah, I agree. Yeah.
So if you have a very low vitamin D, taking 50,000 is not the way to go. You want to take 10,000 for maybe 6 weeks, but you also want to make sure that your digestion, your digestive enzymes, and the health of your gut is healthy, because sometimes the problem is you have gut dysbiosis and you're not able to metabolize from the inactive to the active form of vitamin D.
Absolutely. And I think that's such a good point, because we're talking about supplements. And what you touched on is huge. And I see this all the time. What's going on? You could be eating the best foods and taking all these supplements, but if you're not absorbing, and so many people have issues, and they just think, oh, everybody has constipation or everybody has some acid reflux, no big deal. Well, that's not the case. And the good news is that these are, right, Carol? These are easy things.
Easily.
Easy things that with what you do, that really can be improved naturally. Yes. And so that's what I find. Like, people come in for osteoporosis and their constipation, realizing some of the root causes of the bone loss are also issues people are facing, and they're just sort of not realizing that it's a big deal. But you must be absorbing your nutrients. Absolutely essential. So but they've even found, like, people increase their bone density with probiotics. Not that it's for everybody, but having that great, and they're doing more and more research on the diversity of gut bacteria and how that impacts your bones as well as everything else. So I think that's such an important point. It's not just what you eat, but what you're absorbing. So and that could be 10 hours of talking, but I know you deal with that so much in terms of the gut and dysbiosis, and having and making sure that you deal with those issues so that you are absorbing. And
Margie and I know someone who has severe osteoporosis because he had Crohn's disease.
yes. Yeah.
So,
And I see that as well. And the other thing I wanted to mention about the vitamin D, on my summit, it was really, really interesting, because I had a parathyroid surgeon, and Dr. Diva Boone, and she was incredible. But she said that a problem is too high vitamin D, because she sees these tumors. So, too high is not good either. So just like you said, you don't just start. Yeah, it was actually very interesting, because she looks at it. That's all she sees is people who have the tumors, and anyway. So
that's a really important part, that if you're taking 5,000 IU and all of a sudden your D is like 180 or something. I mean, I've seen somebody like that. That's not because you're taking too much D. You need to be referred for further evaluation, because you could have a parathyroid imbalance, correct?
yeah, it was really, really fascinating what she said. And she actually, what, I can give you that lecture to share if you want to have for yourself, because it was very, very interesting. Because what she said was that doctors, and here she is, a parathyroid surgeon, that's all she does. But she was saying there's a real problem, because doctors in medical school, if your calcium level is high, if your
Right.
calcium is high, if it's a little high, the doctors are like, oh, no big deal. But she's saying
And
no.
I think, let's talk about high, because I've had women that I think had parathyroid problems. Their calcium is usually around 8, and then all of a sudden it's 9, and then it goes 10.2 and 10.8. And at that point, I know that they're having a parathyroid problem.
Yes, what she said though is that the problem is on the standard blood test, it does like adults and children. So like from 8 to maybe, I don't know, 11 or something, or 10 point something is, I don't know the exact numbers, I don't remember, but I know that between 8 and maybe whatever, higher than 10 is considered normal. However, she said nobody over 40 should be 10. They should be in the high 9s. So nobody over 40, whereas a younger person can be. But she said, 40 and over, if that's the case, it's too high. And then she said, people will have symptoms early on, fatigue, malaise, aching. She said it comes with symptoms, but a lot of times they don't correlate it. But
so because of their breast cancer treatment, they're tired because they're aromatase inhibitors, or they haven't gotten enough sleep, or then they're diagnosed with chronic fatigue or something like that.
Right. So her recommendation is everybody check your own calcium, because the doctor may say, oh, no big deal. Let's wait till you have kidney stones, or wait till something else. But she said, absolutely not. The minute, and she said, even if your parathyroid, if the parathyroid hormone is elevated and your calcium is elevated, yes, but the parathyroid hormone can be normal even, and your calcium is elevated, and that is also indication. So the good news though is that the surgery is, you go to a specialist, obviously, but it's like a cure. It's one of those things that I've probably seen at least 5 people, and it wasn't picked up till later. So they've already lost all this bone because their parathyroid, which regulates the amount of calcium that, how much calcium is taken out of your bones, to make it sound easy. So if there's a problem with that parathyroid, and the only problems are tumors, so they have to be removed. But when they're removed, it's pretty miraculous, quite honestly. And so it's something that I think the takeaway is, don't get, everybody listening, but next time you get your blood work, just make sure that, your calcium level is, if you're over 40, your serum calcium is not 10 or over. It's under 10, it's in the 9s. And if not, then, it's hard. It's sad that you have to be the one to do this, but she was saying she's going around trying to educate people, but they're taught incorrectly. She's saying this, incorrectly in medical school about this, about the calcium level. So anyway, it's important, because if I think how sad that is, if you're losing bone and you're doing all these things, but you have this parathyroid tumor that's not picked up until years down the road. So I think that's really important. But anyway, we were back to supplements, right? We talked about the calcium and the vitamin D, which is typically what the doctor.
We haven't talked about food yet. We need to talk. Let's do food.
Okay, yeah. So let's go to that. What do you want to talk about?
Food. People think that eating, it's all about dairy. Like, this is, I don't think people should be eating, in my community, should be eating cow's milk cheese, but it's cheddar cheese and it's Swiss cheese and it's milk. Let's talk about what food has calcium.
Yeah, and it's so interesting. Actually, the gift I'm giving has a whole chart on different foods that have calcium. But that's such a good point, because a lot of people are like, okay, I'll just drink more milk. But as we know, it can be so inflammatory, and so many people have issues with milk. So that is not, and they found the countries that consume the most milk have the highest incidence of osteoporosis. So those milk mustaches years ago and all those things, that's not what we're looking for. Some of my favorites are leafy green vegetables. I love collards, have like 256 milligrams in a cup of steamed collards, and I like to use those. I learned this from Bear Burger, where you can make a turkey burger, a bean burger, whatever you want, and then use the collards just as a wrap. You steam them, and it's so easy. Or there's different recipes. I make some Asian sauce where you can just throw your leftovers in and wrap them up, and really easy. Kale is good. That has 100. That's also higher. And bok choy is great. That's another one that people don't think about, but you can easily
most
chop
women don't know how to do bok choy. They see it, they don't know what it is. So basically you wash it, you slice it, you can saute it with some olive oil and garlic and a little bit of tamari. It's delicious,
That's
right?
exactly what I do. I like ghee. I use ghee. I
Ghee.
use ghee, Ghee. That's the
Yeah,
non-dairy, the fat. And then or olive oil, you can use. And then I love taking leeks, chop up the leeks. I chop up the garlic. And that's exactly what I do. And with the tamari, it is so easy. And I put
good.
some mushrooms in and it's
Shiitake
delicious.
mushrooms, and I put in a little soft. I like soft tofu. I mean, that is a delicious breakfast or lunch.
It's so good. It's so good. But yeah, so those ways you can also get it from sardines with the bones, wild sardines. I love Vital Choice. That's the company I
Yeah,
love. And that has very high calcium. Some of the beans are good with calcium. You have a lot of calcium in the white beans, and you can get calcium that way. Some of the nuts. So there's lots of ways you can use from the almonds. You can get calcium that is not, that's not dairy. So you certainly can, lots of things. You're eating the bones of certain fish. So yeah, so that's really helpful. Prunes are another one that they've actually done research on, showing that increased bone density. It started out as more, but then they came to 6 prunes a day, which is a lot, which is really a lot. However,
I eat about 3 prunes a day because for me, I think prunes, they have a lot of folic acid and B vitamins. They also have a lot of fiber, but it takes off that sugar edge.
do you soak? Yes, so soaking them, yeah. So that's
I
what I
can
learned.
soak them and put them over coconut yogurt, or I'll just eat one.
Yeah. So Dr. Sally Lamont is a friend of
I know
mine. And she also, yeah, Sally. So Sally had shown me a long time ago, actually, to soak them overnight. And so that's what I do now. And they're so good. They're soft. You lose that sugar in them because I certainly care about my blood sugar a lot. We have diabetes in the family, and I'm always very concerned. But the soaking makes such a big difference, getting rid of all that extra sugar. And then they're soft, and you can put them in sauce. So you can do whatever you want with them. But so
I'll
that's
simmer them on top of the stove with a whole lemon, organic lemon that I've sliced up, cover them with water and just simmer them. And sometimes I'll put in a cinnamon stick. So you're getting the warming herbs of the cinnamon, and putting that over coconut plain yogurt is a delicious snack.
Oh, that sounds so good. I have to try that. I love that idea. That sounds great. Yeah. So that's with calcium. The other ones that are essential, are magnesium. And
Yeah.
most people are really deficient in magnesium. And, it's farmed out of the soil, and any of the refined foods, magnesium's taken out. And years ago, they had like a 1-to-1 ratio of calcium to magnesium.
Mm-hmm.
But now they say at least minimum half the amount of calcium, have a minimum half the amount that you have in calcium. So if you're, 1,000 calcium, at least minimum 500 magnesium. But that's combination of food and you can get magnesium in the greens. Dark chocolate has magnesium, cacao. Some of the nuts have magnesium. So there's lots of ways to get magnesium. But the other thing that's interesting about magnesium is, if people do have digestive issues, you can get this transdermally through your skin. And so you can just soak your feet in magnesium. And I used to think Epsom salt was enough, but it doesn't have the amount. It's still good. I mean, Epsom salt's relaxing and wonderful, but it doesn't have as much magnesium as if you actually use some of the magnesium salts, or there's some companies that have some really great magnesium that you can just soak your feet in for 20 minutes to 45 minutes, and you can get a tremendous amount of magnesium. Now, it's funny, I have it actually here. There's magnesium spray.
You know that company. Yeah, I'll send out an email about that. That's a great company.
Yes. So there's lots of good ways that you can get magnesium through your skin as well. So
you can put some lavender essential oil in that soaking and sit there and with your feet in this warm, beautiful magnesium lavender, and do a little meditation, and you're going to change your whole nervous system.
Absolutely. And it's interesting because I've had people call me and just say, oh my gosh, the soaking, they just feel so much more alive and better. And also magnesium is relaxing. So just like you said, it really, it really helps. A lot of people don't realize that, at night they get the cramps, or at night they'll get those, and that's magnesium deficiency. So many people have that, but it's very relaxing. And the other thing with magnesium is that, and this is for some people, I don't know which one. Which one do you like? Do you like the Calm, Carol? Calm magnesium?
I like calm magnesium. I try to match, the magnesium type to what the people need, but also as a supplement, there's magnesium malate, which is very good for calming your nervous system. So there's different forms of magnesium, which we use for different, not just magnesium citrate, which is a powder, which you can use to get your bowels moving, but there's different forms of magnesium, right?
Absolutely. But the interesting thing is for the people that don't have their bowels moving, because a lot of people think, oh, I can go every 3 days, or I can go no, you can't. You have to go at least once a day.
I've had people say, well, isn't it normal to go to the bathroom every 3 days? And I'm like, well, now I know where we need to start to help you recover your health. Let's get you pooping every day.
Right. So for those people, though, the magnesium citrate or the Calm or whatever they're, for certain people, it's like a godsend. I mean, there have been people, because a lot of times the doctor, it's not their first line of defense, magnesium. They'll put you on something else if you're constipated. If you go to
the little red pills, which are useless. I hate those. Or even worse is, what's that powder?
It's starts with an M. It's called, what is it called? It's that they give you. I can't think of Miralax. They'll put, So, but a lot of times I had so many people who are on serious medication and they were able to get off it with switching just to magnesium. So it's just something really important. And it's something everybody needs to make sure they have ample amounts. And so, so that's something though, that's not going to show up, when you're getting the blood work. It's the red blood cell that you're more interested in when you're looking for magnesium. And then the other one, which you talked about earlier, is, K1 is very important too. That you'll get if you eat leafy greens, and that helps with the flexibility of the bone. So if you fall, they've done studies on that with reducing fractures with people they looked at the K1 levels in the nurses' health study and all sorts of things, and it really made a big difference. That's more the flexibility of the bone, not so much the hardness. But the other one is K2, which is essential. And it's so interesting to me, and I still don't get it because there's research about it. Why conventional doctors, it's just not in their arsenal. And I don't know why. There is research, so I don't.
Yeah, there's a lot of research about a lot of things that standard doctors don't pay attention to. But let's talk about the difference between K2 and K7, because I think there's confusion that, I can't take K vitamins because I'm on Coumadin.
Yes, such a good point. Yep.
But K2 is fine. I think K2
K1 is the one that's involved with blood clotting. So K1 is what's involved with blood clotting. No matter what, though, you absolutely need to talk to. If you're on blood thinners, you must talk to your doctor about going on any
K2. Greater than 150 milligrams of K2 is going to give you trouble if you're on Coumadin. It's the K2, not the K1 or the K7.
Well, the K1 is the one that's really involved with blood clotting. So that's why they tell you when you go on Coumadin or certain things, you can't eat a lot of leafy greens. You can't eat too much spinach. Oh, and I just want to say one thing we didn't mention. Spinach has a lot of oxalic acid in it.
I was just going to say,
Yeah, no. A lot of people think, because it will say, if you look at a chart, spinach, 250 some milligrams of calcium. Not that it's bad to take, but you're not going to get the calcium because it's the oxalic acid binds with the calcium, makes it an indigestible compound. So don't count spinach in terms of.
Don't eat spinach. I tell women to stay away from spinach because of that. It's inflammatory. It's better to do kale or collard greens.
And so anyway, where were we? Oh, the K. So K1 is involved with the blood clotting. And K1, you'll get enough. If you're eating leafy greens, you should be getting enough K1. Even you can throw in some basil, like some of the herbs. So it's K2 that has two roles. So this vitamin K2 actually takes the calcium and it makes sure that it gets in your bones and your teeth where it's supposed to. So that's part one. It activates this protein called osteocalcin, which makes sure it gets where it's supposed to go. The second part, it activates another protein. It's called the GLA matrix. Not important to know what the protein is. But what this does, it takes it out of the soft tissue. It sweeps the calcium out of the soft tissue where we don't want it. So it makes sure it doesn't get into your arteries. It doesn't get into your joints. It doesn't get into places where we don't want it. So to me, going on high D high calcium and not getting this, you're doing someone a big disservice. That's my feeling on how important the K2 is, because why would you not want to take it? Why would you want calcium in places we don't want it?
Right.
And
Well,
so,
that's the problem. It makes clots, and it gets into your carotid arteries, and you're in trouble, right? Or your kidneys or your heart arteries. You can get into trouble with that.
yeah. Now the next part, there's not a right answer to the next part. I'll tell you about, and I've actually changed my tune a little bit on it. So the next part is, so there's two types. There's basically two types of K2. There's MK7 and MK4. Now, for years, I've always been putting people on MK7 because I felt it's from natto. It's from fermented food in areas of Japan where they have this natto. It's a slimy type of food. They have much lower incidence of osteoporosis. It has a longer half-life. One study showed that they took 180 micrograms. This was done in the Netherlands, and it decreased loss of the femoral neck, bone density. It improved bone strength, and it also, they showed decreased the loss of the spinal vertebral height. So, I mean, there's research on it, and it has a much longer half-life. So that was always what I had recommended. But since the summit, and I'm always learning new things.
Oh yeah, the summit, it was amazing.
And what I realized is, and there's not a right answer. So there's not a right answer when you're listening to this. MK4 is what animals, they can synthesize K1, eating a lot of leafy greens, and they manufacture K2. So when we eat some of the animal products that have K2 in it, we can get the K2. However, they did studies with much higher doses. So it was 180 micrograms of the MK7. They found 45 milligrams, a much, much higher dose, 15 milligrams 3 times a day of the MK4 decreased fractures. And so some of the presenters said, you know what? They're both good. But at the end of the day, we want to, what's our biggest goal is preventing fractures. And there just isn't the research on MK7 preventing fractures that there is on MK4. And so one of the doctors, Dr. Neustadt, said the biggest thing he does, because he sees a lot of people who are on, he was talking about aromatase inhibitors and how that really, negatively affects your bones. And he said the best thing is to get them on MK4 because so they prevent fracture. So it's interesting. So since that time, I've been doing a deep dive, and I said, there's not a right answer. There really isn't. I've been doing, certain people say MK7. There's not, but they really did have a point that if there's no research on the MK7 and fractures, and there's research on the MK4 and preventing fractures, reduction in fractures, that maybe it's better, so I've been actually switching people now to MK4. I'm not saying it's the right thing.
Yeah, because MK2, well, this has MK7 in it.
Yeah, and that's good. MK7, it's all good. Again,
I don't 7 for bone mineralization. So
it's an interesting thing. And then in the midst of all my research, I was introduced to emu oil, which I'm trying out right now. Emu oil is very high in MK4. So it's very interesting. So it's a natural way to get MK4. So all of it's good. There's not a right answer. And it was just interesting that the people in the summit were very much, 2 of the doctors were very much into MK4 being their favorite supplement in terms of,
Okay. Yeah. And where do we get emu oil? That is organic.
Yes. So it's interesting because I just started trying it. I can,
I need this.
Yeah. There's because and they also say it's great for arthritis. And the person that turned me on to this is Mira Desi. Do you know Mira?
Oh, I know. Of course I know Mira. She's going to be a guest here next week.
Yes. Oh, so funny. So yeah, you can ask Mira because I think she's been using it a long time. So I decided, okay, I want to know the best sources of MK4 and the most natural.
I'll post that here, ladies, for you to find. Once I find out, I'll let you know.
And yeah, so I haven't told people to do it yet because I'm still trying it myself. I'm making sure, but Mira has used it for years. And so I was asking Mira what about certain supplements, because she's the ingredient guru and always knows the absolute purest of purest. And she says, Margie, why don't you just put people on emu oil? And so I'm trying it myself. The concentration isn't as high as the research studies have used, but it's interesting. It doesn't taste bad. And it's so the person who who runs the company, they said they're so short on it now, though, because of supply chain.
Everybody is needing it, and
Yeah.
we have the supply lag. So it's a lot of stuff
Yeah.
is on back order.
Yeah. So anyway, so that's just another way. So I think those are I mean, everything's important, eating the whole, making sure you get enough protein too. That's a big one. People were thinking, oh, too much protein causes calcium to leach in the urine. You don't want too much. The research isn't showing that. The research is showing you must get enough protein, because if you're not getting enough protein.
How many milligrams a day do you think women need?
Well, I think it depends. I think it depends on what else you're doing and what your activity level is. And, there's certain formulas. Oh, approximately. I mean, depending on each meal, at least, let's say you got 20, so I mean, there's a way you can.
A minimum of 60 milligrams, 60 grams.
I would say that I would say that's reasonable. I mean, there are some serious charts and things like that, but yeah, as long as you're getting protein, some protein each meal, if you ran 20, yeah, I think that's a good way to look at it. But a lot of people don't get enough protein, and they're not only are they going to lose bone, but they're going to lose muscle. It's called sarcopenia, so it's a problem. Yeah. But the other thing I really did want to talk about is the vibration unit. I think
let's talk about this. I can't wait to hear about this.
Yes, I think this is such a good thing for your community, because, I mean, for everybody, sometimes you may be immobilized, or you may be. So what happened is the scientists going to NASA, they lose bone. They're up in space. They're not getting any forces on their bones. So they were trying to figure out what can they do. So one of the people who was doing the research, Dr. Clint Rubin, he works at Stony Brook. So I've interviewed him twice, and he started studying this type of vibration, which is totally safe for anybody with breast cancer. It doesn't do anything to cancer cells. It doesn't, it doesn't do, I'm sorry, my battery was looking low. I just want to make sure I don't lose it. Okay. It doesn't do anything to cancer cells. They've actually done research making sure it's safe. And you stand on it for just 10 minutes a day. That's it. And it's not one of those, and I'll talk about that in a minute, that throws, it's not a power plate. It's nothing like that. It's a very low intensity, high frequency vibration. And what that does is it's just the right, it's sort of like the Goldilocks level of vibration for that stimulates in the bone marrow. It's called mesenchymal stem cells, and they can turn into fat, or they can turn into bone. So what this does, it's just the right stimulus to cause them to turn into bone instead of fat. So it's just
I need this 100%. I don't want them turning into fat. No, thank you very much.
It's a wonderful adjunct to treatment. And when people are unable to be really active, they've done studies on children who are bedridden, different things, and it really has helped. And so again, it's not the end all. It's not like I'd say, oh, just do this. It's just part of it. I've been doing it for 5 years now.
Right. It's part of the protocol.
Yes, it's part of the whole, the exercise, the nutrition, taking care of your system, reducing stress, that's what works. It's the whole thing. However, it's a nice piece of it. And, I've been on mine for 5 years, and I use it every day unless I'm away. And you only have to stand on it 10 minutes. It's just so easy. So I put the TV on. You can use it and do like meditation. You can do mindfulness. I tend to just at the end of the night when I'm watching something fun, I just stand on it. But it's easy, and it's not cheap. That's the only issue. But it's amazing. It's insurance. Some different policies, do cover things, but it's incredible. And it's interesting because a lot of people say, oh, well, how is that different than the power plate? Or they'll see some very inexpensive ones. Is it the same? And the answer is it's absolutely not the same, because they've actually studied, and there's in the workplace, it's ISO 2631 is the name of it, and they've studied vibration in the workplace, and they show that at certain G forces, like how much G force you're getting, at certain forces, it's not even safe. Like this unit, they said is safe. I think it was for 16 hours. What am I saying? I wrote this down so I could give you 4 to 8 hours a day. Like the one that I like is the Marathon unit, and that's safe for 4 to 8 hours a day. Whereas some of the power plate, they haven't, and this intensity is, I think it's 0.4 G is what the intensity is. It's not even 1 G. But they're at intensities of 8 10, 15 Gs, when they're really shaking you. And they say that that's not even safe for 16 seconds.
Okay, well, we're not buying that. We're going to buy
Yes.
something safe. We don't
Yeah.
need shaken to the point where we're having a big problem. I think
And
women with
also,
breast
it's not
cancer
safe
need to
on the
be,
brain. There've been
yeah.
a couple of things of retinal detachments, and the reason on those devices they say bend your knees is they don't want that force coming into your brain. So anyway, so this is the only unit. There's one other one, the Juvent, but way more expensive, and it's from the same research. So this is the only unit. It's worldwide. They have it, but it's the only unit that that they have that delivers this kind of frequency, and it's just easy. I've had patients using it for years now, and really good results. What I've seen, again, everyone's on a whole program, but what I've been seeing is that people are at least able to maintain. Now, given this population, your population of people when they're on, it may make things worse when they're on the aromatase inhibitors and other things. But for the most part, it's just another thing that's giving you some bone building, some stimulus to the bones that's saying, hey, it's just, so I think it's a great thing they've done. I sent you some articles on the safety of it, with cancer patients. And
I'm going to post this. What is the name? I'm going to post a link.
yes,
Margie has
yeah,
that's a special pricing. So all this information is going to be posted onto this Facebook group page.
perfect.
Maybe today or tomorrow. But what's the name of the unit, Margie?
The
Somebody is
unit
asking.
Maridon,
Spell.
MARODYNE. And the other thing about it is that when I spoke to, it's interesting now because there's such a demand for it, and they get it out of Germany. It's made in Germany, the specific unit. So you sort of have to order them, and then I don't know if they have them in now or not. I'm not sure. They come in waves.
Well, I'm going to find out. We're going to put all this
Anyway, they
information.
gave me. I spoke to the person because I asked when I was going on here if they give us a special code, and he said yes. So anyway, so you'll get $200.
You're going to get the link and the code and everything. So it'll be
Yeah,
there
but I
for you.
just wanted to mention it because the therapists all use it. We all use this certain unit, but it's just something to know about, that it's not like everyone says, oh yes, and do not, you'll hear, oh, you can do a much cheaper one, or you can do this, or you can do that, but this is the safest one and the one that they've really researched.
That works. I mean, don't spend, less money sometimes is a waste of money. Let's get you the right thing at a special pricing through Margie, and let's make sure it is going to be part of your bone health protocol. And I think the message that we're saying here is, one is that there's a great deal you can do other than just, quote unquote, go in for your infusion for your bones every 6 months, number one, which makes you sick. Number two, even if you are doing that, you also need to do a whole protocol for your bone health. As I recommend, you do a whole protocol for your immune health, for your health in life. I mean, there is a bone environment, there's a gut environment, there's the micro environment in your body. We want to make that inhospitable to cancer, but we want to make the bone environment hospitable to healthy bones. So we have to really attend to all of this with our nutrition, very targeted specific supplements, not just calcium carbonate. Please do not buy calcium over the counter at Trader Joe's or Costco or CVS. Please do not do that. You're hurting yourself. I will be talking about the specific calciums that you need, and I'm going to update my recommendations now that I've spoken to Margie about the MK4. And when we have our bonus week of, side effects of aromatase inhibitors. So that is what's going to happen soon. So Margie, thank you so much for being here with us. And any parting words?
No, I just think, look at this just like everything. The good news is you look at it as an opportunity. If you find out you're going to lose bone, well, what can you do? And then all these things that you do are going to just really impact your life in a positive way. So,
oh, yes, we have to talk about happiness.
Oh, yes, yes. Oh, yes. I mean, I found that happiness is important for every aspect of your life. Just learning different tools you can use to raise your happiness level. But so one of them is sort of, if you can always, look at, sometimes it's hard to see the silver lining while you're going through it. But there is a silver lining. When you take care of your bones, everything gets better. And
Well, look at her smile, ladies. Look at March's smile. I mean, she practices what she preaches. She has this beautiful, vivacious, brilliant smile. She's posture is beautiful, and I can feel my energy shifting when I stand up forward. And I need to watch out. My mom had very, very bad osteoporosis, and I have been determined from, many, many years ago not to have that happen to me. So I am all about taking care of my bone health and my bones too. So thank you, Margie, for your time and your efforts and your energy and your expertise. And we've talked for an hour, and it's up. Ladies, have a lovely day. There'll be more tomorrow. And this is Carol Lourie signing off for now. Margie, just hang on for a second after we thank you, Sherry and Deborah, for being here. And there'll be more later. And have a lovely afternoon, everyone.